Golden question. Take me through your CV. Sounds simple, right? Wrong. I've seen brilliant doctors completely bomb this question by doing exactly what it asks. They literally walk through their CV page by page, boring the panel to tears and wondering why they didn't get the job. Don't do this. Today, I'm going to show you the psychology behind this question, the massive mistakes 90% of candidates make, and the bulletproof framework that will make the panel remember you for all the right reasons. Let's dive in. Welcome back. I'm Sharon, one of the doctors working in NHS. My aim is to help you ace your interviews and advance your careers, whether you're preparing for foundation training, specialty applications, or that crucial consultant interview. Mastering this one question could be the difference between success and rejection. The CV walkthrough appears in virtually every medical interview, yet most candidates treat it like a formality. Big mistake. This is your golden opportunity to control the narrative and set up the entire interview in your favor. By the end of this, you'll know exactly what the panel is really looking for, how to structure your answer for maximum impact, and I'll give you a complete example you can adapt for your own interviews. Let's get inside the interviewers' heads for a moment. When they say, "Take me through your CV," they are not asking for a biography. Here's what they're actually evaluating. First, communication skills. Can you organize complex information clearly? Can you prioritize what's important? Remember, if you can't explain your own career journey coherently, how will you communicate with patients and colleagues? Second, self-awareness. Do you understand your own strengths and motivations? Can you connect your experiences to your career goals? They want thoughtful reflection, not just a list of achievements. Third, relevance and focus. Can you tailor your message to the role you're applying for? They want to see you understand what they need, not just what you've done. Fourth, personality and professionalism. This is often their first real impression of you as a person. Are you engaging, confident but not arrogant, someone they'd actually want to work with? Here's the secret. This question is setting up the entire interview. The topics you mention here will likely be explored in follow-up questions. You're not just answering, you're creating the roadmap for the rest of the conversation. Now, let me show you the disasters I see regularly, so you don't make these same mistakes. Fatal mistake number 1, the page-by-page reading. Monotone voice. Well, on page 1, you'll see my personal details and qualifications. Page 2, my employment history. Stop. You sound like you're reading the terms and conditions. The panel already has your CV. They don't need you to narrate it. Fatal mistake number 2, the chronological marathon. Rushed voice. I started medical school in 2018, first rotation in cardiology, then respiratory, then surgery. Mind-numbing list of dates and hospital names. The panel's eyes glaze over after 30 seconds. Fatal mistake number 3, the modest mumbler. Uncertain voice. I've done some research, a bit of teaching, some audit work. Generic, forgettable, wasting precious time. Fatal mistake number 4, the kitchen sink approach, trying to mention everything you've ever done because you're worried about missing something. Nothing stands out because everything's mentioned superficially. Here's the truth. You have 2 to 3 minutes max for this answer. That's about 300 to 400 words spoken. Every word needs to count. Here's your solution. The CAMP framework, perfectly adapted for CV questions. C. Clinical experience. A. Academic achievements. M. Management and leadership. P. Personal qualities. Let me show you how this sounds. Naturally, confidently, ready for your own interviews. Hi, I'm Sarah. I'm currently completing my FY2 year in the West Midlands, having graduated from Birmingham Medical School in 2023. Over the past 2 years, I've rotated through 6 specialties. including acute medicine, surgery, psychiatry, and general practice. What's drawn me most strongly to emergency medicine is the combination of clinical diversity, rapid decision-making, and the opportunity to make an immediate difference in people's lives. Clinical experience. Clinically, I've developed strong diagnostic skills and confidence in acute presentations. During my A+E placement, I managed over 200 undifferentiated patients independently, from chest pain to psychiatric emergencies. I've become proficient in procedures like lumbar puncture, chest drains, and arterial line insertion. My surgical rotation gave me valuable experience in trauma assessment, while my medicine placement strengthened my clinical reasoning skills, especially in complex medical presentations. Academic achievements. From an academic perspective, I'm passionate about medical education and research. I've published 2 papers on emergency department triage systems and presented my research at the Royal College of Emergency Medicine Conference. I've also been heavily involved in teaching. I coordinate the weekly simulation sessions for FY1s in our trust and developed a teaching program on emergency procedures that's now used region-wide. Management and leadership. In terms of leadership and management, I've led 3 quality improvement projects, including implementing a new handover system that reduced patient waiting times by 25%. I serve as the junior doctor representative on our patient safety committee, and I've been involved in updating several clinical protocols. I also organize our monthly journal club and coordinate the rota for junior doctor teaching sessions. Personal qualities. Personally, my colleagues describe me as calm under pressure and always willing to help. Outside medicine, I'm a keen rock climber and volunteer with mountain rescue, which has actually enhanced my teamwork and emergency response skills. I find this combination of physical challenge and helping others really complements my passion for emergency medicine. Strong closing. All of these experiences have confirmed that emergency medicine is where I want to build my career, combining acute clinical care with teaching and service improvement. Notice what this answer does. It's conversational, not robotic. It gives specific examples and numbers. It connects experiences to the role they're applying for, and it opens up multiple conversation threads for follow-up questions. Now, let's take this to the next level, with pro tips that separate good candidates from great ones. The evidence sandwich. Don't just claim skills, prove them. Instead of, I'm good at teaching, say, I coordinate weekly simulation sessions for 20 FY1 doctors, and our feedback scores consistently rate above 4.5 out of 5. Create strategic hooks. Mention interesting details that you want them to ask about later. That mountain rescue experience, that teaching program, those are conversation starters that let you shine in follow-up questions. Tip 3. Mirror their values. Research the department beforehand. If they emphasize research, spend more time on your academic section. If they're known for teaching, highlight your educational contributions. End with purpose. Always connect your experience to why you're there. All of this has led me to emergency medicine because, or, this is why I'm excited about this training program specifically. Be aware of common timing mistakes. Clinical section too long? Save details for specific clinical questions. Personal section too detailed? Keep it brief but memorable. No clear ending? Practice your closing line. Here's your homework. Record yourself giving this answer. Time it. If it's over 3 minutes, cut it down. If it's under 90 seconds, you're probably being too generic. And remember, your approach should evolve with your career stage. Medical students or FY1s focus more on clinical placements, university projects, and potential. FY2s or core training applicants balance clinical experience with emerging leadership roles and clear specialty direction. Registrars emphasize subspecialty expertise, research contributions, and significant management responsibilities. The CAMP framework works at every level. You just adjust the emphasis and depth for each section. Remember that confident candidate from the beginning? That's you. after mastering this approach. You're not just answering a question, you're taking control of your interview narrative. The CV walkthrough isn't a throwaway question. It's your moment to shine. With proper preparation, using the CAMP framework, you'll transform this potentially boring recitation into a compelling professional story that makes the panel excited to learn more about you. Here's your action plan. Download my free CV walkthrough template in the description. Practice your answer out loud until it feels natural. Aim for 2 to 3 minutes maximum. Record yourself. Watch for filler words and unclear sections. And subscribe for more interview mastery content. Quick recap. Use the CAMP structure for organization. Use specific examples with evidence. Connect your experiences to the role you want. Create hooks for follow-up questions. Practice until it's conversational, not robotic. You've worked hard to get here. In our next video, we will learn how to answer the most tricky question. Tell me about the mistake you made. So, stay tuned. Don't forget to share and subscribe.